Hi, I'm Dr. Ford, and I want to talk to you today about carbohydrates and what they mean, what they are, and I've done many videos on this. I run into people, I see 20 to 30 people a week, and there's different goals, different reasons for consulting with a dietitian, and it ranges from weight management to IBS to newly diagnosed diabetic to preventing diabetes. And a lot of times carbohydrates come up and people want to reduce their carbohydrate intake. And I think in our society, I live in the United States, we have ultra processed foods which have higher chances of having added sugars or refined starches. And with that being said, there's less fiber. So if you are trying to reduce your carbohydrate intake, I want you to also remember to increase your fiber. And by pairing those two together, eating less than 50 grams of carbs, if you're measuring it in macros, I would just watch out for your full nutrition capacity. Where else are you getting your nutrients? What exercises are you engaging in? What are other systems that you need to make sure are operating okay? How's your digestion? Are you pooping every day? How's your sleep? How's your liver and your kidneys and your pancreas? Like, I would want to understand, because fat metabolism happens in your liver, in your small intestines. It also requires your gallbladder, your pancreas. It requires a healthy lymph system. And so I would just want to make sure that if you are engaging in a low carb, it's not because you saw it or your aunt's doing it or someone else is doing it, or your friend's doing it, because you are changing how the biology works. So carbohydrates, there's three simple sugars: glucose, fructose, galactose. And then there's disaccharides: maltose, sucrose, lactose. Those are the simple sugars. And then you have polysaccharides, which can or cannot contain more fibers and nutrients. The more fiber a carbohydrate food will have, the less response it has on your blood sugar. And so if you can focus on find foods that have carbohydrates that also have 5 grams or more of sugar per serving, that will help the blood sugar response. And I believe in my practice, that's going to help you prevent or reduce your risk of metabolic disorders. Hope that helps.